everybody, and welcome to Open Agenda WTF, where the WTF stands for With the Facts. We're here to have respectful dialogue on events and things that are happening within the state of Colorado. And I'm Tracy.
Hello, I'm Lynn.
And today we're going to let Lynn speak about the Affordable Care Act and some things that she has found that apply to the state of Colorado. And I think that you will all be very interested in what she has. And so I'm just going to say, take it over, Lynn, and let's go.
Okay, let me know if you have any questions, Tracy, and
Absolutely.
please leave comments or questions below. The Affordable Care Act is a huge thing to dig into. And so I had a couple people ask me, what is going on with the Affordable Care Act and why is everyone so worried about it? So I decided to try to figure out more information, more facts, so that we can understand what is going on, if there's anything to be fearful of, and what we can do to make it better. So welcome back to our channel. The Affordable Care Act is also known as ACA or Obamacare. And I promise I'm going to keep this fun and simple, but we are going to be covering today what the ACA was originally intended for and how it was set up, who qualifies and who doesn't qualify for that kind of insurance, why the enrollment in the Affordable Care Act has skyrocketed, and what's about to expire and why are people so worried about it. Last thing, what keeps the costs rising and real solutions to fix the system. So the Affordable Care Act was enacted in 2010. It took it about 4 years to roll out fully, which included a big Medicaid expansion. The Affordable Care Act was created for temporarily unemployed people, self-employed people, students, or folks who weren't insured by their employers. Because traditionally, we always had our health insurance provided by our employers. The goal of the Affordable Care Act was threefold. One, to make insurance more affordable, to expand Medicaid so it would cover more adults, and to control healthcare costs. Who qualifies? Who qualifies for all this these days? In order to qualify for affordable health care benefits, you must be a U.S. citizen. You must not be incarcerated. You must have an income between 100 to 400% of the federal poverty level. And I'll define that for you. Yes?
I am wondering, are there really that many people that are under the poverty level? I mean, there's so many people that are worried about this, and it's like, is there really all these people that are so poor? I know I am, but but yeah.
Well, the federal poverty level is $15,650 a year annual. So yeah, I'd say that there's probably, I don't know how many people. I don't know. That'd be a worthy topic to explore. But that is a low income. It'd be hard for one person, and that's for a single person. But I'm going to get more into that. And we're going to
Okay.
get more into it when we talk more about how these fit into Colorado's legislation. The third type of person that can qualify is a lawfully present immigrant. And you asked me that great question. What does that mean? So I found a link that we can post below that comes from the National Immigration Association, or whatever they're called. It's a government document that defines who lawfully present immigrants are. And basically, they are people that have permission to live here because of education or things like that. Maybe they've been here for a long time. They may be refugees or asylees, people who are running for their life from another country. And there are 22 detailed descriptions below. If someone is applying to change their permanent status or their long-term status, they can even apply for the Affordable Care Act. It seems like there's a lot more people that are eligible than maybe would be appropriate. It's something we need to take a closer
So
look at.
these are those qualifications. They don't have to meet all of those qualifications.
No, no,
Okay. So
no.
that's why there's so many people on the Affordable Care Act. It's not
Yeah.
that they have to be in poverty. They can be another class. Yeah.
They can be between 100 to 400% of the federal poverty level.
Okay.
So 400% would mean someone who's making $62,000 a
Okay.
year.
Yeah.
So anyone making less than that this year is eligible. These rules they vary from state to state. Each state handles Medicaid differently. There's just a lot of details that make it very complex. People between 100% to 138% of the federal poverty level can automatically be shuffled to Medicaid, which is free, totally free health care. So they are usually placed on Medicaid rather than using the Affordable Care Act.
Okay.
When employers are insuring people, their insurance has to be capped at 9% or less of a person's annual salary. In 2021, that is when the Affordable Care Act changed during COVID with the American Rescue Plan Act, that is also referred to as ARPA. This expanded those ACA subsidies to anyone. There was no cap on what percent of the federal poverty level you were at.
And these are what are about to expire at the end of the year.
And this is about what's
Okay.
going to expire. These subsidies for people that are earning over $62,000 per year. So in real numbers for 2025, federal poverty level is $15,650 for a single person. 400% is 62,600, or for a couple, the 400% federal poverty level is 84,600, a couple with no children. This sort of sparks debate for me because I'm really wondering, should taxpayers be paying for health insurance for people that make over $62,000 a year? This also in 2021 sparked massive enrollment growth. In 2020, the Affordable Care Act had 11.4 million enrollees. In 25, we have more than double, 24.3 million. And in Colorado, and again, these 50%, 60% rates vary by state, but in Colorado, our enrollment grew by 69%.
That's huge.
It's huge. And Colorado actually developed its own private Affordable Care Act called the Salud, Omni Salud program that passed in 2020 and was launched in November of 22 that gives access to illegal citizens or non-citizens. We're going to get more into that next time we talk. But again, the ARPA expires at the end of 2025. And states are warning that premiums will rise without it. Premiums were set to rise before the government shutdown and before all these fears because of a number of reasons. It's nothing new that premiums are going up. Healthcare premiums go up every year. It's normal. In 2017, our premiums for healthcare jumped 21%. And for 2026, the projected increase is about 25%. So the reasons that healthcare is becoming more expensive every year is one, healthcare technology costs are rising. There is an increase, a huge increase in chronic disease. We're talking about diabetes, heart disease, mental illness, autism, asthma, obesity.
Wow.
These are all the types of diseases that create a whirlwind of problems and cost a lot of healthcare. One of the things that caused growth this year also was the rise in GLP-1 medications, the weight loss drugs that you hear about, Wegovy, tirzepatide,
Are those covered?
Ozempic.
Are those covered? Ozempic?
In the ACA, they are not covered, but they are causing a 6 to 14% increase in employer paid premiums or plans you get from an employer. Another big piece is all the spending on non-eligible non-citizens. That's contributing to the costs. And what's happening is the plan networks are getting narrower and narrower, and people have less and less choice. Almost all of the ACA subsidies go directly to insurance companies. In 2023 alone, $218 billion were paid to insurance companies. Insurance company stocks are up over 1,032% since 2010.
Shouldn't shouldn't I mean, why is it paid to insurance companies? And maybe you're going to get into this, lowering the cost and providing care for people. I mean, why are we subsidizing insurance companies?
Why are we? Because that's exactly what's happening. We're subsidizing insurance companies.
Hmm.
That question we need to dig into a little bit more. And I hear this reported that really the insurance companies and the bureaucrats are the ones that are benefiting from the Affordable Care Act. So we need real reform and real solutions. And I'm a big fan of the MAHA movement and the things that RFK Jr. is doing in the Health and Human Services Department, because they are going to be the ones that are going to have a big part of making this. It's going to be like turning the Titanic.
Right.
You know, it's a huge, huge bureaucratic debacle.
Well, it didn't get there overnight, I guess. So
No,
been
it sure
years.
didn't.
Yeah.
We have to say the Affordable Care Act has helped people, but it needs an update. The people who are benefiting from the complexity and the confusion of the plan are powerful interest groups and insurers. And really, the way the system is set up now guarantees that it will continue to grow more and more affordable every single year, more and more unaffordable every single year. If we have a new model, if we start looking at a new model for healthcare insurance, it would need to rely on doctors, patients, employers, not government bureaucracies and insurers. Remember how my mom always would say, you want to see something get really worse or really slow or really expensive, just hand it over to the government and let them take care of it, right?
Who was it? Ronald Reagan, who said, "I'm from the government and I'm here to help you."
Right. So, some solutions. I've got about 5 ideas here. One is we need to limit the open-ended federal subsidy commitment. That really means that the federal subsidies are open-ended. They don't have a limit on how they can keep sending out our money to pay for these costs. Number two, we need to reduce insurers' pricing power. They're the people that are in charge of what things are costing. Number three is allowing subsidies to fund a health savings account that would give more control to individuals.
Good idea. Yes.
And number four, we need to educate our public about healthy living, healthy lifestyles, healthy foods, preventative habits. In my world, that all seems like common sense knowledge, but for many people, it isn't.
Mm-hmm.
They don't realize that drinking 10 soda pops a day is giving you a pound of sugar that causes inflammation and obesity and diabetes and all the chronic diseases that are crippling our country.
Or sitting on a sofa and playing video games instead of playing outside or going for hikes and enjoying our beautiful outdoors here in Colorado, right?
Absolutely,
Yeah.
yes. The last part of that is if we can create access to clear pricing information, we can provide informative clarity and competition so that insurance companies have to come back into a market that's affordable. I have a great quote from Newt Gingrich. He says, transparency doesn't just lower prices, it changes who holds the power. So
I like that. Yeah.
yeah, he's brilliant. In closing, the Affordable Care Act is broken. It's outdated. With smart reforms, transparency, better consumer education, we can create a system that's fair, sustainable, and puts people first, and puts the people in Colorado first. Because honestly, the Affordable Care Act is no longer affordable.
And that's the reason that it's such a political football these days. And yeah, very good. Very good information. I like the layout for those that don't understand exactly why they're fighting so hard about this Affordable Care Act ending in December.
Yeah.
And just getting back to the insurance companies are the ones that are getting rich through this. And it's not, yeah, that's where everything I think is bottlenecked. And so that needs to be taken care of, just like you said, you know. So I appreciate your explaining all of that, many things that I didn't know, and I'm sure that our viewers have been very educated as well. And we're going to continue on this tomorrow, right? Or what
Yes.
and what are we going to talk about tomorrow?
Tomorrow, I want to talk specifically about Colorado's part in
Excellent.
the Omni Salud program. And I think that question of if we, maybe I can develop a flow chart or something that shows how the funds are manipulated and where they're going, basically.
That would be excellent. Yeah. I don't want to rush you on this, but yeah, let's do that.
Yeah, let's do that. Yeah, I find it fascinating.
Yeah, and in last week's video, you can find that online here in YouTube, but we talked about how the shutdown has affected the Colorado farmers, and I might do a little update on that just because some of these issues have come to light since the shutdown, where it really has affected so many people in so many different ways with the healthcare, the reason for the shutdown, and then just getting back to Colorado roots and Colorado farmers and diving in a little bit into how it has affected the farmers since it's been what a couple weeks. I don't know. It's been a little while since the government's back to work, but I'd like to see where everything is at with that. We will be back on live again tomorrow. And
All
I'm
right.
looking forward to that.
Me too. I think it's really good that we can find these things that affect real people, that affect us, that nobody's talking about. The news, they're not talking about these kinds of things in real life.
That's
And
why everybody needs to share this, is that
mm,
we get the word out there. And it's not
mhm,
just about what the mainstream media wants you to hear or wants you to know.
exactly.
So let's share this and become educated population, right?
Yes.
Yeah,
Keep educated and pay attention, because if you don't, someone else is going to be writing the rules.
that's right. Thanks, everybody. We'll
Thanks,
see you
Gracie.
tomorrow.
Thanks, everyone.